everyone. I have with us today for this next episode of Ask the Expert, Jenn Bindon, who is a familiar face to many who are watching probably. Jenn is one of our midwives here in town and runs Prairie Midwives. Welcome, Jenn.
I do. Thanks.
Thanks for coming.
Yeah, thanks for having me. It's great.
So why don't you tell us and everyone watching a little bit about yourself, your family, your practice.
Okay, it's kind of loaded. All right. So yeah, I'm Jenn Bindon. I'm the owner of Prairie Midwives, a midwifery practice in Central Alberta. I have 4 kids. I have a stepson who's 14, a daughter who's 13, and then 2 little guys who are 4 and 1. And I grew up just outside of Edmonton, but moved here for college, so quite a while ago now. And so Red Deer's really just become home. So we kind of settled and stuff here. I have a Bachelor of Science degree in nursing, and started nursing about 20 years ago. And then went to midwifery school, started midwifery school in 2008, graduated in 2010. So now I've been practicing midwifery for about 8 years.
Awesome. Yeah, and have been very instrumental in our area at not just beginning, but also growing the practice, and I think educating other women as well on some of their birthing choices.
Yeah, definitely trying to get more options out there, working with Alberta Health Services and our association to increase funding, all of those things that kind of come hand in hand with trying to get more options out there for women.
Awesome. So was that desire kind of what led you from doing traditional nursing to midwifery? Or what kind of made you want to decide to do that?
Well, I always had, so when I graduated from nursing school, I knew I always wanted to work maternity care, obstetrics. Okay. There was no other nursing really for me. Okay. And so I ended up doing an education program at one of the bigger centers in Edmonton for 12 weeks. And it was taught by someone who'd had midwifery experience and stuff. And all of my instructors early on in my career, in my nursing career, were all sort of midwifery minded or had more of this sort of natural bend for how things, quote unquote, should be.
Right.
And so I always had that frame of mind. I always had that mindset.
Okay.
And so I could have stayed in Edmonton at the bigger center, but I was like, the epidural rate's really high here. Right. This isn't the kind of birth that I want to participate in every single day.
Right.
So I came back to Red Deer because at that time, our epidural rate was like 11%. People used the tubs. There was a lot of the nursing staff were trained by midwives from the UK on that unit. Okay. So that's why I came back to Red Deer, because I always knew that's more of the what I wanted to be a part of. And so and then what drove me to midwifery, I think, was just spending enough time in a system with a systems-based approach that I really realized wasn't for me. I really firmly believe in patient autonomy and a woman's choice. And too many times in a system, it's really hard to deliver individualized care. Right. And it's not that as nurses or obstetricians or family physicians that we don't want to deliver that kind of care, but when you're looking at, then there's another person behind you and another person behind you, then becoming a part of that system wasn't sitting well for me. It wasn't comfortable for me. So midwifery was a way of for me, and for feeding my soul. Right? Like I love birth, and I like to know my families. I like to work with people and meet them where they're at. That's really important to me. So that's where midwifery kind of fit in for me, that I could do that for me. Awesome. And then also help women in that too.
Awesome. Cool. So one of the main reasons that I really wanted to have Jenn on and to discuss birth with her was to be able to give many people accessibility, I guess, and to have a lot of women have some of their questions answered. So I know not everybody that wants to have midwifery care here in our city is able to. And yeah, I thought maybe we could just touch on some of the advice that you do give to your families and to your birthing moms. So why don't we start there?
Okay.
I'm going to get you to kind of give me some of your best birthing, labor and delivery counsel, advice, whatever you want to call it, to, let's say, first-time moms.
Okay.
That's a loaded question.
There's
so many things in that question.
We might need to break that down a little bit. But
so maybe like first thing that comes to your mind.
Educate yourself. That's probably the one biggest thing. And because what we do, and every woman is different, every family is different, every social structure is different. Right. It is really different for everybody. But when I'm talking to people in our care, it's about taking a minute to sort of examine your life. What is important for you? Why is that important? What do you need to know around that? And then how can you establish a plan around that? Now, a plan doesn't always mean that that's going to happen, but it means how are you going to make sure that you are the most successful at what's important to you as possible, right? So that might come from who's the best care provider for you, right? Do you have type 1 diabetes? Well, then your best care provider is going to be someone who is really good with the medical side of things because you have a chronic medical condition. So that's when you should see an obstetrician. But is natural birth also important to you? Sure. So then you need to make a plan, and you need to find the right provider, and you need to be able to have those discussions with your doctor so that you can make that happen, right? And then what's your support? What do you have for support? Because this is one time in a woman's life where she can't do this. You can't do this by yourself. Right. You can. Yes. You can squat under a tree and bite a stick and have a baby. We're animals. We're mammals. We can do that. Right. But it's really not ideal. Right. Yeah. So it's examining what do you have for support. Yeah. Who are your people? How can you build your system? And I think that's probably the most important thing for people to be able to put together for themselves. Because I can't do that for you. Right. I can't tell you that you should have a doula or you need to have a midwife or. Right. Or just your husband should be enough support for you. Yeah. Right. So it's really taking that time to examine your structure and go from there. So this wasn't on the sheet of questions either, but just going. Oh, great! Thanks. Yeah. You're welcome. You're welcome. Why is support so important? Like that might sound like a silly question, but why? Why is that so important? That people have people around you that support you? Why is it so important to have support during your birth? Does that affect your birth outcomes? Like what? I mean, let's unpackage that a little bit. I guess it depends on what are you thinking about? If it's just the day of the birth, is it the birth and your postpartum? Is it your pregnancy and your postpartum? Or is it this huge life transition that you're about to go through, right? So if you sort of take that as an all-encompassing period of your life, then you need support because it is the most difficult for a lot of people, the most difficult transition. Yeah. And so support is what gets us through anything, right? We're social animals, and we need to have that. And so finding the people that meet your expectations, that share the same values and belief systems around what's important to you. I mean, that is why support is probably the most thing. And for a lot of people, that's just their partner, and for some people, that's an extended family, and for some people, that's their immediate family or close family. Some people hire support. Yeah. Right. So it really just depends on what your family dynamic is like and what your system is like. For sure. Okay. Let's talk for a second about intervention during a delivery. Okay. And maybe the time leading up to a delivery. Is there a way? Are there things that pregnant women can do to reduce their risk of having any intervention during birth? So whether we're talking about midwifery care or whether we're talking about in-hospital medical care.
or a delivery by a physician,
Mhm.
are there things that women can do to reduce their chances of needing or requiring medical intervention?
For sure. And again, it's super individualized.
Okay.
Number one, education. So I think it's really important for women to know what could lead to more interventions. So things like medical induction, for instance, chronic medical problems, diet, how's your nutrition, all those kinds of things that can kind of lead to having more problems, right?
Yeah.
Obviously, if a healthy pregnant woman can go into labor spontaneously, has good support systems where she feels comfortable, strong, supported, to let labor kind of carry on, and anything that's going to reduce her degree of fear, not pain, fear.
Right.
That's the biggest, probably number one thing.
Okay.
Of figuring out how to be okay with this, what's happening, tends to be the people who have the lowest level of intervention.
Okay.
So when you're talking about preparation or what you can do to make that happen, I can't say enough about support. Support is number one. Who's going to be there telling you that it's okay? Who's going to push you over that help push you over that next hill? Who's going to tell you that you can do it, that you've got it, you can handle this last little bit, or you can whatever, right? So support is a big thing. Education to minimize the fear is really where your prenatal education should be driving. Right? Sure, it's one thing to know is what is meconium and what is this and what is that. What are all those actual things that can happen? But really, the women that I find who can carry out their plans as best they could are the ones who can stand back and just be like, I'm letting this happen. I'm letting this unfold. It's okay. I'm not fearful and I'm not suffering. And so, those are the women that tend to do better. And a lot of that, and every woman's different, but a lot of women for that, it's headspace. So if you prenatally or in pregnancy, if you deal with a lot of anxiety, you need to figure out how you can cope with anxiety, because labor for anybody is very anxiety provoking. It's scary. It's nothing you've never done before. There's going to be a lot of apprehension. So for every woman, it's examining, okay, my mom had really terrible births, or my sister, I watched her have a baby and I'm terrified of my perineum tearing. Okay, so take that. What do you need to do with that? How can you reduce the level of fear? Do you need to ask questions? Do you need to read books? Do you need to read birth stories? Do you need to not read anything?
Totally. Shut that off.
Just
say no. No, thank you.
Everybody's really different.
Yeah.
We have some people who are like, I'm not reading anything because I know that I can birth a baby and it's going to happen the way that it needs to happen.
Totally.
And I have some people, I always caution against not reading if it's out of fear.
Yes.
Right?
Yes.
So it's kind of finding out what's your thing? What are you going to have to overcome? And I find every woman throughout this transition has to overcome something.
Totally.
And it's never what they think it's going to be. So is it, I really don't want to be induced. I really don't want to have an induction. Well, then you're 42 weeks and 4 days and your water breaks and there's meconium and okay, well maybe it's going to be a good idea for you to be induced. Okay, how are you going to get over that? Or it's the last 3 weeks of pregnancy when my hips hurt and my back hurts and I can't move around and it's so hard and I can't sleep and but then labor's 6 hours and is a breeze. But those last 3 weeks were torture, right? So everyone has to overcome something. So what do you need to do to overcome?
I think that's a really interesting point that you make about fear. And I think from the kind of philosophy that I do a lot of my treatment as well and I will, is understanding that there's a physical response to fear. Right? So it's not simply like, it's not just like a head thing, although that is a big part of it, and maybe reframing some of your thoughts. Something that I say often to my clients is that hurt doesn't always equal harm, right? And so there is a component of thinking, but there's also needing to understand the physical response to pain is to do this, contract, right? And the physical response to fear is to contract.
Same thing. Yeah.
So, and then that's when we start to see maybe labor is not progress as much, and more birth injuries and that kind of thing. So, I think that's an interesting point that you make. Let's move on for a second and talk to you or get you to speak to women about VBACs. Okay, so this is I see a lot of clients, attempting to have a VBAC. So now we're moving from our first-time moms to maybe to subsequent deliveries. And can you kind of give us the, the lowdown on VBACs? So for women who are wanting to have a VBAC, what do they need to do? What are the rates like? Is this a good option for everyone?
Sure. So VBAC means vaginal birth after cesarean section. And it used to be that once a woman had a section, she should always have a section. That was kind of the recommendation. Now that's, research shows us that all women and all of our governing bodies who give us guidelines and who give us information about stuff, say that every woman should have a choice. Now, of course, there's some women where the risk for having a vaginal birth after cesarean could be considerably higher.
And what would those?
The most common one would be if your incision on your uterus was an up and down incision. So instead of being like that bikini line incision, it'd be an up and down. That puts a woman at much higher risk for the uterus to rupture and open up in labor as soon as it starts contracting, and sometimes even late pregnancy. So those women, the recommendation would be for them to strongly have a cesarean section afterwards. And for all of the other reasons that women have cesareans, success rates are somewhere between 65 and 85% successful. So for a lot of people, they're like, well, it's sure worth a try. There's definitely risk. I mean, uterine rupture is always the big risk, right? When that uterus has been compromised, then the tissue's not as strong. And so when it's contracting, when the head's coming down, then what you don't want is for the uterus to just open up, right? And that can have pretty catastrophic consequences. So for any of our moms who are planning a vaginal birth after cesarean section, we talk a lot about risks and benefits, how you can minimize risk, what are your options, all that kind of stuff, things we're watching for, things we're not. And most of them see an obstetrician as well once in their pregnancy so that they can get good balanced information about what their options are. Because of course when you've had a cesarean the first time, the second time you can choose to have a repeat cesarean section or have a vaginal birth or attempt a vaginal birth. So somebody who's had a breech baby for a C-section for their breech baby the first time probably has more of an 85% success rate being successful. Right? So 85 is maybe a little high in our current conventional management because we carry Central Alberta is carrying about a 30% cesarean section rate now. So anybody has a 70% chance of having a baby vaginally, 30% chance of having a C-section. So so it's somewhere around there. I think for most people it's really, and again, it's people have to look at their individualized situation, right? If you had a really long, difficult delivery with your first baby, then sometimes people are like, well, why would I
want to do that again?
Why would I want to do that again to end up having a C-section anyways?
Totally.
And so you can definitely appreciate where people are coming from. But I think the big thing with any of those big informed choice discussions is arming yourself with questions. So that you can say, well, what are my risks of a cesarean section? What are my risks of a vaginal birth? What if this happens? What if that happens? So that you feel good about your decision. And I find that women, even if women have cesarean sections when they didn't intend to, or they've tried for vaginal birth and weren't successful, it's not about the C-section. It's not about, well, I wanted a baby to come out of my vagina, and that didn't happen for me. That's not what it's about. It's about feeling powerless, and it's about feeling like they didn't have control, or that they didn't make that decision. And so we really aim to make sure that that we have the kind of philosophy where we're working with women.
Right.
And you want to find a care provider, whether that's a midwife or not, you want to find a care provider who will work with you, where you don't feel like you're butting heads, where every question that you ask isn't met with like an eye roll or a sigh, right? And so that's where it really comes down to finding the right care provider, and being able to talk with other women who've had similar experiences, so that you can educate yourself about what options you do have or don't. You know?
And I think too, I just want to touch for a second on, you know, maybe if you're listening and you are somebody who has had maybe not an awesome birth experience that first go around. There's more and more research coming out, looking at or talking about, showing that there really are real emotional effects that can that can cause having an adverse birth experience, or a traumatic, what some would say a traumatic birth experience, and I think working through that process a little bit, finding a counselor, finding someone that you can talk to about that, is very, very important, I think, as you're heading into a second delivery. And I think too, like C-section versus vaginal delivery, it's not like there's one, I don't know, I think sometimes people, they feel bad sometimes when they have a cesarean, but I don't think they need to, right? And I think that as long as you have felt supported, and as long as your birth has been your birth, then that's really what the goal is, right? Exactly. Whether it's cesarean or vaginal delivery. So,
and I think we've kind of gone, some people or sometimes people go a little bit too far the other way.
Right.
It's not only about a safe outcome. Of course, a safe outcome is always our number one.
For sure.
But what kind of has happened is that sometimes a safe outcome trumps the experience.
For sure.
And you can have both. You can have a safe outcome, a healthy mom, healthy baby, and a good outcome, and in the vast majority of cases, right? Yeah. Sure, things happen, bad stuff happens, there's no doubt about that. Yeah. But very, very rarely, and unfortunately we've kind of made it where that happens more often than not. Yeah. And so yes, you can have a good, safe outcome and still feel good about your birth, and still feel positive about mothering and parenting and your postpartum period and coping and all that kind of stuff. It doesn't have to be one or the other, you know? And sometimes we have people who are so tied to that VBAC, they just want that vaginal birth so bad that then they might have a problem in the vaginal birth, that then they're devastated because now the vaginal birth wasn't this like, oh, wonderful, beautiful thing, you know, and then they're like, oh, maybe I can have a section, right? So it's really about making sure that you can be open to what's gonna be, the things that you can't control the things you can, and the things you can't, figure out how to let go of those things, right?
Yeah, that's good counsel. Okay, we are totally like hashtag working moms right now. There's like 6 kids running back and forth out here that we're trying to not
I need to make sure that little baby one doesn't see me.
Yeah. If you hear that noise, I apologize. Okay, let's move off birthing just for a second and talk about breastfeeding. Okay. We are going to have somebody come in and actually do like lots of breastfeeding talking for us. But is there anything that you kind of advise to your clients that they could maybe prepare a little bit during their pregnancy for breastfeeding?
Not a lot, frankly.
Okay.
Because
thank you.
Some, sure. So usually what I'll say to our clients is get one of the standard books, right? The Womanly Art of Breastfeeding, Jack Newman's Guide to Breastfeeding. There's some really great books out there. And read like the first 2 chapters. Getting started. Awesome. What do you expect? So how often does the baby eat? What are their patterns look like? And then watch some videos just on like what does a baby look like when it's latched? What does a normal latch look like? Right. And different ways to hold the baby. Now, when you get a baby for the first time, you're gonna be all like, I don't know, like when they hold them down here, and like this, and I have my boob like that, you know, like
so weird.
It is weird.
I just need to say that my first experience breastfeeding, I was like, what is this happening? Is this my baby? It took me a while. Like,
it does. It takes a while. I mean,
it was not all blissful at the beginning.
The good thing about it is that you basically have to do it every 2 hours.
It's true.
For the foreseeable future. So you learn fast
You do.
how to do it, right?
You do.
It's like changing a diaper. You change 5 diapers, you've changed 1 million. Once you
got
got it, you got it. But yeah, breastfeeding's much the same thing. Like we talk about it being natural and stuff. It's weird. It's not something that you.
Initially,
I've done it for 10 years.
Yeah, it's awesome.
But it
takes some practice.
It takes some practice.
Yeah.
It takes a little bit of a learning curve. So I think just knowing what to expect and what's normal.
Perfect.
And then you're not going to always have somebody staring over your shoulder saying, "Oh, that's a good latch," or "That's not." So if you've seen a latch before, especially if you've grown up and you haven't been around breastfeeding women, I think in cultures where everyone breastfeeds. Women or people who breastfeed grow up with an innate knowledge that you don't even know you have.
Right.
You're like, oh yeah, this is where. Oh yeah, she's breast. You put the baby's legs there, and that's just how it goes. And because you're used to seeing it, but we're sort of coming out of generations who haven't breastfed. So a lot of us didn't grow up with that and didn't ever see anybody breastfeed. So just getting some basic knowledge of it. Don't read the whole book. Don't read about all the things that can go wrong or
keep it simple.
Be difficult. Just know your basics, and again, know your support. So
seek out some people if you need to.
Exactly. So have conversations with people.
Yeah.
If your mom didn't breastfeed, and you don't have a great relationship with your mom, she's not the person that you're going to be asking for breastfeeding help, because that's when you might hear some interesting things that we hear about.
Right.
Your milk's not rich enough, or maybe your milk is sour, or maybe the baby doesn't like it, things like that.
Yeah.
Right? So who are your friends that breastfed? Did your mom breastfeed? Did your aunt breastfeed? Do you not have that? Okay, maybe you need to make sure you have a lactation consultant who's available, or how are you going to access that help?
Yeah.
Just so you're not on your own. Right?
Yeah, it's good to have that number before, have the number on the fridge before you need it.
Yeah.
Right? Like, put your numbers on the fridge.
Yeah.
And then in that moment, you just make the call.
Right.
It's nice to have that.
Or who are your friends that you're going to commiserate with about breastfeeding, or that you've been up all night, or who are those
Who
people?
can come over, what girlfriend can come over to your house and...
Yeah.
Okay, great advice. I love it. Okay, let's talk for a second about the 4th trimester.
Okay.
Do you want to explain what that is?
4th trimester. So, 4th trimester is that period after you've had the baby. And I don't know if there's an actual definition for how long the 4th trimester is. Is it?
I kind of thought it was 6 weeks. Is it not?
Well,
is it 3 months?
We could consider, 6 weeks to 3 months.
Or some people would say even just, I don't know.
I'm going to tell you 18 months is how I feel.
3 years?
I don't know, a long time.
3 years.
It's that period of time where there's still very active transitioning after you've had a baby. So whatever that is. And I think, and almost all of my clients will hear this from me, plan for your birth, sure. Get to know some stuff and get your ducks in a row and have your support ready and stuff. But what you actually really need to plan for is your postpartum period, is that 4th trimester. So the birth is a day. You have very little control over what's going to happen, or how it's going to happen, how it's going to start, how it's going to end, what's going to happen in between. It's one day of your life. Postpartum is
more days,
anywhere from 6 weeks to 3 years.
Yeah,
who knows? So you really do need to make sure you're preparing for that. And I often compare it to a wedding and a marriage, right? You plan so much for the day of the wedding, and everything's perfect, and la 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 la, and then you forget that you're going to be married to that person.
Perfect.
Who farts in his sleep, and who,
leaves a sock on the floor.
Exactly, who leaves the empty milk container in the fridge, right, for a lifetime.
Right.
And so it really is putting the time in where it's needed.
Yeah.
And the day of really doesn't matter as much.
Okay. So can you let's talk practical things, maybe 2 or 3 pieces of advice for people planning for their 4th trimester, or for what they can do during their 4th trimester.
Okay, so number 1, you've heard it before, say me again, support.
Okay.
Who are your people?
Have your people.
That is the most important thing. So if that's your partner, so lots of times we'll talk to first times moms and they're like, oh yeah, no, my husband's taking a week off work. I'm like, that's great, but not enough. Yeah. Not even nearly close to enough. So I always encourage people to look again at their family dynamics, who's helping, who's not helping, and do you have a lot of fluff that you need to deal with? So like, do you have boundary issues with your mom, where she'll come over and help, but she'll also organize your pantry, which is going to make you really mad at the time when you're already emotional, already tired, and your mom's taking over. So you have boundary issues, okay, you need to address those. So you need to be like, Mom, sometimes when you come over, and it makes me mad, and I just don't really want that to happen right after I have the baby. Right. So could you maybe, and then try and strategize, right? So then could you just ask me before you do those things? Or could you, and have those conversations when it's there's not so much fuel for the fire, to have those kinds of conversations. So it's not just about support. It's not just about people. It's how are those people helping, and what are they doing? I often recommend for all of the close family who are going to see the baby in the first day or two, grandparents, siblings, to have a little mini open house. You can come on day 2 between 4 and 7. Perfect. That's it. Yeah. Because what happens is, obviously, there's those important people in your family that are going to see the baby in the first few days. Yeah. And that is important because you're welcoming a new person into your family. Sure. But what tends to happen is they trickle. It's like, oh, grandma can only come after her nap, which is at 2 o'clock, and da-da-da-da. And then you spend all of day 2, day 3, which are probably the hardest days as far as establishing breastfeeding and sleep deprivation, getting used to that. Then people trickle in all day, and you don't nap, and your boobs are leaking, and it's just kind of a mess. Yeah. So I usually recommend, whether that's even day 1, it's just everybody can come for 3 hours. You've set those boundaries, and then that's it. They're gone. And then waiting for friends, maybe later on, a couple of weeks and stuff. I mean, we have some people who are like, well, I just want anybody for 2 or 3 days. And I'm like,
that's tricky too.
Your parents who love you and are very excited, it's fair, right? That they'd see their baby soon enough. So, so I that's usually one of my really practical kind of pieces of advice.
I'm going to add one. I'm going to say it's not your time or I'm going to say it's your time to rest. Also, and I know that sounds super common sense, like everyone knows that. Sometimes we feel like we still want to do when really we just need to be, and that period should last quite a long time. So,
and that's hard.
It's very hard, but it's really also necessary from a physical perspective, from a healing tissue perspective, from a long-term wellness perspective. Those first 6 weeks are critical to your body healing and healing well. And even though it's hard, even though sometimes we get that urge around 4 weeks that I feel like we're ready, I feel like I'm healed, I feel really awesome, I'm going to go for a run. It's not your time to do this yet. So I would add that to the 4th trimester, that it's just your time to be with your baby and to bond and to figure out some dynamics between your husband and your rest of your kids, and it's just your time to heal. And it's precious, and it is actually very short-lived.
And you'll never get it back.
And you'll never get it again.
Never get that time again.
Never. So embrace it and use it wisely to rest and to heal. Awesome.
That's great advice.
Okay, one more question.
Okay.
And then we're going to be done, because this was longer than I thought it was going to be. But we could talk all day.
Let's do a symposium.
Forget the interview. We're going to do a whole symposium.
A weekend.
Yes.
Yeah, okay.
Let's do that.
Let's move it together.
Any book. So this is what I think sometimes. People are always like, oh, you're pregnant, you should read this. You should read this. Why don't you, have you looked at this website? This is a great book. And sometimes I'm like, there's so many things, so many books. What is 1 or 2 reading resources that you recommend? Like if someone was going to pick one thing.
Ina May's Guide to Childbirth.
Ina May's Guide to Childbirth.
Yeah,
Awesome.
That would be my number one.
Okay.
The first half of the book is birth stories. The second half is sort of more birth philosophy and, you know, kind of information and stuff that way. And because it's so individualized, different people need different things.
Right.
So I don't think you can say, oh, What to Expect When You're Coaching is the best book ever.
Yeah.
You know, in fact, it's a very fear-based book, and so I wouldn't recommend that one. And for some people, it's just read birth stories. Just watch YouTube birth videos. Just, you know, because it's going to bring stuff up that you're like, oh, I didn't know about that. Oh, I didn't think that could happen. Oh, okay, well, what does that mean? And that's what sort of starts guiding you to find the information that you need and that's important for you, as opposed to just sort of this generic, all over the place information. I mentioned Womanly Art of Breastfeeding, Dr. Jack Newman's Guide to Breastfeeding, just for those initial books. And I don't know, I like birthing from within, parts of it.
Okay.
I like hypnobirthing, parts of it. For a variety of different reasons. And I would recommend that no one just subscribes to one kind of philosophy or one kind of way to have a baby, because there isn't just one way.
I feel like we've circled right back to the very beginning when Jenn said, and this was one of the big themes, is that everybody is different, and you really need to do some of your own work to figure out what's important to you. What people do you want to have around you, and what do you need going in, and that's going to be different for everyone.
It really is, and I it's the lack of preparation sometimes, and I mean we do talk about like what does it mean to prepare. But I remember when I was nursing, and people would come in and they'd be like, okay, no, I want a natural birth. I'm like, okay, that's great. What have you done to prepare for that? And then I get crickets and the blank, empty stare, and I'm like, okay. So you just, that's not going to work. You know, for most people, right? And so it is that emotional, psychological preparedness, along with some, for most people, is going to be some sort of didactic knowledge.
Right.
But really, it's eliminating or reducing the amount of fear you have around the process.
Love it.
That's the big stuff.
I think that's all.
Okay.
Yeah. Thanks, Jenn.
You're welcome.
For being
Thanks
with
for
us.
watching.
Yeah. If people did want to get a hold of you, or if they're looking for services from Prairie Midwives, how would they go about doing that?
So on our website, www.prairiemidwives.ca, under the Contact Us heading, there is a link to the general provincial waitlist form. So anyone who's pregnant, and you need to be pregnant to fill out the form, can fill out that, highlight Prairie Midwives if you're in the Central Alberta region, and then we do unfortunately have a wait list for care. The last time I looked, 1 month, I think in May, we had 38 requests for care. We took 11 clients. So there is still a long wait list, but we are working on expanding services and getting more midwives as funding comes. So
awesome. Sounds good. Thank you for being here.
Nicole.
Yeah. Thanks for having me. You're welcome. That's great. Good.